So this next story kind of paints a bit of a dark picture with respect to aging in this country. And I guess, we spend so much time talking about how difficult it is for young people these days, trying to be able to buy a home and get on, their financial footing. And then you read this and you think, wow, it's obviously not limited there. So it is a new survey from the National Institute on Aging. And it basically suggests that optimism about aging has fallen. And this is happening relatively quickly, literally over the last year. Anthony Pizzino is CEO of the National Association of Federal Retirees and is on this line. Thanks so much for being here. Let me ask you, as I said, we don't spend a lot of time talking about aging necessarily as we do, talking about youth today and the problems they're having. What surprised you in this report the most?
Oh, thank you, Aaron. And we should be talking about all generations, of course, but sadly, not a lot surprised me because it is reflecting what our 170,000 members have been telling us as we survey them. And that is that affordability constraints and isolation and a lack of adequate health care, long-term care, and home care are having an impact on their well-being and their happiness.
So if I can, first of all, as a definition, when we talk about, aging and older parts of the population, where do we start? Is this at age 50?
We can. Well, part of what the study found actually is attitudes about ageism as well, which is something that we're very interested in talking about as well. But
okay.
I think if we start at age 50, that would be a good starting point for the conversation. Although there is a large demographic of individuals that are going to create a large part of our Canadian population into the 2030s and 40s. And part of the importance of the conversation and the study is that we need to be prepared for that. We've been talking a lot. The country has been talking a lot. Policymakers and politicians have been talking a lot. But we need to take action to take care of those individuals.
Well, so I brought up 50 because if I read right in the report, it says the youngest group of older adults, so those are age 50 to 64, they are the ones struggling the most. Now, you would have thought it might have been an older demographic, but that's not what this survey says.
No, that's exactly, and I think it's a reflection of where we are today with respect to the economy and the lack of investments in the areas that the study pointed out things like retirement income security and access to health care and long-term care.
The other thing I noted, maybe you can speak to this as well, I'm sure it applies across the board. The figure cited here says isolation comes up as one of the most important things, or one of the saddest perhaps situations here, and that younger cohort, that 50 to 64, is dealing with that the most.
And that points to affordability. I think to be involved in some of the social activities requires money.
Sure.
Requires funding. And when you're struggling with transportation and housing and health care and groceries and so on, people are looking to where they should be spending money. And unfortunately, things like social activities are one of the things that will be affected.
Yeah, which is, of course, the irony, right? Because it's that kind of thing that can actually make you feel better, yet it's a thing you can't afford to do. So perhaps to see isolation come up as, the top item isn't that surprising at all. What happens here? You mentioned primary care. What's the issue with primary care? It's access to it or lack of access to it?
It's lack of access to it. So a large number of the population don't have access to a primary healthcare provider. So that obviously has an impact on well-being. So looking to making sure that there are investments in those areas are important, but also that those primary care providers actually are equipped to take care of an older demographic, of an older population as it ages.
So we're talking about some of the problems that are obviously here, and I realize there's, as you said off the top, a lot to be done. What is the recommendation here? Someone's listening saying, hey, I'm approaching that age, or I'm in that age right now. I'm starting to feel some of these things. How do they reach out? What do they do?
Well, I would suggest that where you start out, because we've been having this conversation for such a long time, is to policymakers and politicians. They're, who represents them at the constituency level. Members of the Legislative Assembly, members of the federal government. We need to actually take action and start by protecting income retirement security, public pensions, OAS and GAS, availability earlier than we have it now at 65, ensuring that there is support for caregivers, having a national caregiving strategy that we don't have, having a national strategy on aging, which we don't have, making sure that there are standards for long-term care that are enforceable. So the list is long, but it's not impossible. So investments in healthcare, investments in long-term care, and investments in home care and community care, with the choice to allow individuals to age with dignity.
Yeah. I was just going to ask, because we have to wrap up. You've highlighted the points that have to be discussed. Are you optimistic? I mean, are you talking about this with the government? Are they open to these sorts of suggestions? Or what are you seeing?
We are always optimistic, and we engage with political parties of all stripes. We're nonpartisan. So I am optimistic that with the kind of studies that we're seeing, with the kind of conversations, and thank you for bringing attention to this point, we can make a difference. The numbers are large, and they will be growing. The population of seniors is rising, 18% in 2020. We're going to be 24% by the 2030s, and projections are that over 10 million individuals are going to be seniors by 2040. So it's a large percent of the population, and we are optimistic that we will have an influence to change policy.
I wish you luck, and I think for everybody listening who finds themselves or the parents or whoever in that situation, that is in fact what happens. Mr. Pizzino, thanks so much for your time.
Thank you, Aaron.
Canadian women are looking for more out of themselves, their businesses, their elected leaders, and the world around them.
And that's why we're thrilled to introduce the Honest Talk podcast.
I'm Jennifer Stewart.
And I'm Catherine Clark. And in this podcast, we interview Canada's most inspiring women.
Entrepreneurs, artists, athletes, politicians, and newsmakers, all at different stages of their journey.
So if you're looking to connect, then we hope you'll join us.
Listen to the Honest Talk podcast on iHeartRadio or wherever you listen to your podcasts.